In 1973, psychologist David Rosenhan conducted a groundbreaking experiment that would shake the foundations of psychiatry forever. He and 7 other pseudo-patients feigned auditory hallucinations to gain admission into psychiatric hospitals across the United States. But what happened next was far more disturbing than anyone expected. Once admitted, these pseudo-patients behaved normally, telling staff they felt fine and had no further hallucinations. Yet, despite their obvious sanity, they remained hospitalized for weeks, some for over 2 months, diagnosed with serious mental illnesses like schizophrenia or bipolar disorder. The experiment revealed a terrifying truth. Once labeled mentally ill, a person's normal behavior was often dismissed as symptoms of their supposed disorder. The psychiatric system, it seemed, was trapped in a cycle of confirmation bias. Staff often misinterpreted the pseudo-patient's actions, taking note-taking as signs of obsessive behavior, or boredom as depression. Even fellow patients often saw them as genuinely ill, highlighting how powerful labels and context can be. Rosenhan's study posed a fundamental question. Can psychiatrists reliably distinguish sanity from insanity? And if not, what does that say about our entire mental health system? The results sparked intense debate and led to major reforms. But the core dilemma remains. Mental illness is not always clear-cut, and our definitions may be influenced by stigma and institutional practices. Imagine being locked inside a psychiatric hospital, treated as dangerous or delusional simply because someone said you were ill. Even your perfectly rational actions are viewed through a lens of suspicion. The pseudo-patients reported feelings of powerlessness, invisibility, and frustration. Trapped in an environment where no one truly listened to them. Despite their efforts to prove their sanity, staff clung to diagnoses, often interpreting every behavior as proof of illness rather than recovery. The experiment also showed how dangerous psychiatric labels can be, affecting people's self-perception, social interactions, and even legal rights. Rosenhan's work called attention to the dehumanizing conditions in many psychiatric hospitals, including neglect, depersonalization, and sometimes abuse. It forced society to reconsider what it means to be mentally ill and who gets to decide that label. The study remains controversial. Critics argue about ethics and methodology, but its impact on psychiatry and psychology is undeniable. It opened the door for patient advocacy, improved diagnostic criteria, and a push toward more humane mental health care. More than just a scientific test, the Rosenhan experiment is a profound exploration of identity, perception, and the thin line between reason and madness. Are we defining mental illness or merely reflecting our fears and prejudices? What if the system itself is the one that creates and sustains insanity. This experiment forces us to question who is really crazy, the patient or the institution? And more importantly, what can we learn about compassion and understanding from this unsettling revelation? Today, mental health care continues to evolve, but Rosenhan's experiment remains a sobering reminder. Labels can trap, and sanity is often in the eye of the beholder. Have you ever wondered how society defines normality? How fragile the boundary between sanity and madness really is? If this story intrigued you, leave a like and subscribe to the channel so you don't miss more fragments of the mind, where we reveal what many prefer to ignore.